Dr. David Albert at the Digital Health Summit here at CES 2019, and I am pleased to be speaking with a friend of mine, Jane Sarasohn-Kahn, who is one of the insightful people here in digital health, and she has the Health Populi blog, and her handle is @HealthyThinker. So she's a deep healthy thinker. Welcome, Jane.
Thank you, Doctor.
Tell us what's new in your world.
What's exciting in the world of health, and especially digital health, is the fact that there's clinical evidence now supporting many of these things can work, particularly now that we have cloud computing. I'm not even going to say AI. I'm going to just say we can get data
You
more.
just said it.
Yeah, we won't say it again in this session. But we can actually start to see data liquefy, go where it needs to go. Open source healthcare, particularly with APIs and FHIR standards, F-H-I-R, where we can finally appify inside an electronic health record and bring patient-generated data where we live, work, play, pray, cook, toilet, whatever, wherever we need to get it from, can finally move to where it needs to go, so we can actually get more informed and go beyond the claim, the medical claim. So we understand mood, we understand if somebody's depressed, which plays into a lot of risk factors for diseases. We understand sleep, another determinant of health, and then the other social determinants of health, which are so important for overall health and wellness.
So you are generally optimistic about the trajectory of digital health and how it's having an impact on healthiness.
I'm optimistic in where we are at the early part of the adoption curve. There's been a lot of hype, and this is the 10th year of the Digital Health Summit. So I've been coming for 9 years, and I see this expansive floor. Finally, this year, I see real things with some evidence. Not everywhere, but I'll give you an example of something that I've been waiting for a long time, and I don't get paid to say any of this. Randy Kellogg of Omron is not a client. He's become a collegial friend, but I've been watching Omron take a long view to doing clinical blood pressure from the wrist in a smartwatch, and they were just FDA cleared. Hello, you're very lucky.
Well, Omron is an investor and partner, and Randy's on my board of directors. So.
Oh, well, and we did not plan this. Hello, God's truth. But Omron took a long view, doing the hard job of working with the FDA. There are over 80 patents in that watch. The valves, double valves, and double pumps, the size of a rice particle. And it's clinically validated, and all you have to do is put your hand over heart. This is, to me, groundbreaking. One example of something that's real, FDA cleared, and solves a need.
Well, you have a lot of companies here, developing new wearables, connected underwear, all kinds of things.
Yeah.
I think what we have to wait and see is where will this shake out? What of that data? Yesterday, there was a session at the Digital Health Summit, my friend Dr. Ann Curtis talking about doctors can't be deluged with every time you go to the bathroom. So,
Absolutely.
So we've
got
to learn how to we've got to learn how to process the data so that instead of data, we deliver actionable information. Do you think that's right?
Absolutely. We need the outlying information, and also we need to leverage new kinds of health workers. So when I think about the primary care medical team now, I'm thinking about the nutritionist on the team, maybe a diabetic educator, a skincare person. But in a PwC study, again, not a client, recently looking at reinventing primary care, they asked doctors, what professional type would you add? What FTE would you add to your practice for what you need now? And it wasn't mental health, that was number 2. It was nutritionist and dietitian, because of what weight and food do to human health and the obesity crisis. So I look here at the emergence of so many sound, food, weight management, exercise, nudging technologies, well beyond my initial Fitbit I used to have in my pocket, but now this Fitbit Versa. nudges me, because I'm a home-based worker at a desk, to get off of my tail every hour, and you do the 250 steps, and you get to your 10,000 by the end of the day. So now I think we're starting to get real about these things. And Fitbit's doing corporate wellness now because they're making the case and have the evidence. So again, these maturing companies who are getting real about value-based care and what value is it to the patient and the payer.
Yeah,
We need
I
to have
agree.
both.
Well, certainly there are new remote monitoring codes from CMS that may
Yes.
facilitate, because
That's what-
physicians have been reluctant to track this data because it's not in their workflow.
That's right.
Workflow being a critical element in medicine.
Sure
Well,
is.
Jane, thank you for your always prescient insights. We had Jane Sarasohn-Kahn at Healthy Thinker and Health Populi blog. Thank you very much. This has been Dr. David Albert at the Digital Health Summit here at CES 2019, hosted by our friends Living in Digital Times. Thank you.